evening everyone. Myself V. Gurubalan, studying BPT first year in SNS College of Physiotherapy. First, I would like to thank our chairman, technical director, correspondent madam, principal, vice principal of SNS management for giving me this wonderful opportunity. I am proud to be part in the 5 pillar activity. Now I am going to present AIDSCLT. Today my topic is artificial intelligence and data science in sciatic nerve. Artificial intelligence, data science, sciatic nerve. Sciatic nerve is also called sciatic nerve. This is thickest and largest nerve in our body. It is peripheral nerve in our body. This opening is located deep in the buttock, just below the piriformis muscle. It begins in the pelvis and terminates at the superior angle of the popliteal fossa by dividing into the tibial and common peroneal part. Sciatic nerve இது வந்து நம்ம பின்னாடி பக்கமாக இருக்க தொடையில் இருக்கும். Root and origin. It has largest branch of the sacral plexus. It is made up of two parts, tibial part and common peroneal part. Tibial part oda root value என்னன்னா lumbar 4, lumbar 5, sacral 1, sacral 2, sacral 3. Common peroneal root value lumbar 4, lumbar 5, sacral 1, sacral 2, sacral 3. Sciatic nerve arises from the spinal nerves of lumbar 4 through sacral 3. Spinal nerves. Termination in the middle of the back of the thigh, apex of popliteal fossa. Sciatic nerve வந்து popliteal fossa வந்து ரெண்டாக பிரிஞ்சு வரும். ஒன்று என்ன நர்வ்னா tibial nerve, இன்னொன்று common peroneal nerve. Divides into two terminal branches, tibial and common peroneal fibula. Courses. Sciatic nerve continues the course of through posterior to thigh. It runs between the long head of the biceps femoris muscle and the adductor magnus muscles laterally to the semimembranosus muscle, also gluteal region and pelvis. Relations. Superficial relations. From above downward, the sciatic nerve is related to gluteus maximus at gluteal region, long head of biceps femoris at thigh. Sciatic nerve is reachable on the back of the thigh, only in the angle between gluteus maximus and long head of the biceps femoris. Deep relation. From above downward, the sciatic is related to body of the ischium, posterior surface, tendon of obturator internus, gemellus superior, gemellus inferior muscles, quadratus femoris, adductor magnus. Branches. Muscular branches. Biceps femoris. Biceps femoris எங்கெங்கெல்லாம் சப்ளை பண்ணுன்னா supply to short head arises from the common peroneal part and supply to long head arises from the tibial part. Biceps femoris ஓட long head வந்து tibial பார்ட்டுக்கும் short head வந்து common peroneal பார்ட்டுக்கும் சப்ளை பண்ணும். Semitendinosus வந்து tibial பார்ட்டுக்கு மட்டும் சப்ளை பண்ணும். Semimembranosus arises from the tibial part. Tibial பார்ட்லேருந்து தான் semimembranosus வருது. Adductor magnus arises from the tibial part. Adductor magnus, semimembranous, semitendinous மூணு மசிலுமே tibial பார்ட்டுக்காக தான் வருது. Articular branches. Hip joint arises in the gluteal region. Gluteus minimus, piriformis, superior gemellus, obturator internus, inferior gemellus, quadratus femoris. Sciatic nerve of sensory function of sciatic nerve. Sciatic nerve does not have any direct cutaneous functions. It provides indirect sensory innervations via its terminal branches. Tibial nerve supplies the skin of the posterolateral leg, lateral foot and the sole of the foot. Common peroneal nerve supplies skin of the lateral leg, the dorsum of the foot. Motor function of sciatic nerve: inversion, eversion, dorsiflexion, plantar flexion. Inversion of the foot: movement of the foot towards the midline of the body. Eversion of the foot: movement of the foot away from the midline of the body. Dorsiflexion of the foot: pointing the foot upward. Plantar flexion: pointing the foot downward. Motor functions of sciatic nerve: inversion, eversion, dorsiflexion, plantar flexion. Inversion of the foot: movement of the foot toward the midline of the body. Eversion of the foot: movement of the foot away from the midline of the body. Dorsiflexion of the foot: pointing the foot upward. Plantar flexion: pointing the foot downward. Applied anatomy of the sciatic nerve. Sciatica is nerve pain from an injury or irritation to the sciatic nerve which originates in your buttock gluteal area. The most common cause is a herniated or slipper disc that causes pressure on the nerve root. Very common. Sciatica typically affect only one side of the body. Medication for pain and physiotherapy are common treatment. Artificial intelligence in sciatic nerve. Private office. Corso Trustee 123 00198 from Italy. Accepted 2 June 2005. Available online 14 July 2005. In studying patient with sciatic nerve varices, the author found that the sciatic nerve and its major divisions, tibial and peroneal nerves, could be readily identified on ultrasound imaging of the popliteal fossa. The sciatic nerve lies in the space between the popliteal vein and the small saphenous vein. The use of ultrasonography to guide local anesthetic injections for SN block to obtain anesthesia in the lower limb has been reported. Ultrasound guided sclerotherapy is now a commonly performed treatment for varicose vein. It is clear that the extravasation of the sclerosant occur following injection near the SPJ. The SN may be damaged by the sclerosant. Data science in sciatic nerve. 30 unselected patients attending for outpatients consultations were investigated by duplex ultrasound examination of the popliteal fossa. In 10 subjects, varicose vein were present in 20. Number of varices were visible on the clinical examinations. Artificial intelligence is intelligence demonstrated by machines as opposed to natural intelligence displayed by animals, including humans. And data science. Data science is an interdisciplinary field that uses scientific methods, processes, algorithms, systems to extract knowledge and insights from noisy structured and unstructured data and apply knowledge, actionable insights from data across a broad range of application domains. And thank you.